Even I have marked it yesterday. Okay, mimic callosian. Recurrent callosian will be seen in sebaceous cell carcinoma. Okay, recurrent callosian will be seen with sebaceous cell carcinoma. Most common site of cancer is lower lid, right? Lower lid. But there is a cancer which will be only seen on upper lid, or most common cancer seen on upper eyelid is sebaceous cell carcinoma. Okay, this was your recent question. Okay, I am giving you less data, so make sure that you read it properly. Okay, there has been around 13 questions from the same PDF. ठीक है, 13 क्वेश्चन है यहाँ से. ओके, लेस डाटा दे रहा है उसका मतलब ये मत समझना कि इसमें से नहीं आता. ओके, कॉमन पॉइंट और कैच पॉइंट विल बी सेम ऑल ओवर द प्लेसेस. वो नहीं बदल सकते. केस सिनेरियो दे रहे हैं तो दे हैव टू गिव कॉमन पॉइंट्स. ओके, सो यही तरीका होता है पढ़ने का. हर चीज इस टाइम में नहीं पढ़नी होती. व्हाट वी नीड टू डू, वी नीड टू गेट दैट कैच पॉइंट्स. कोई पढ़ा के देता है, टीचर्स, and sometimes it is your hard work. Okay, hard work for all the subject will help you more than the just doing videos. खुद भी पढ़ना है, कहना ये चाहता हूँ. ठीक है, फॉर एग्जाम्पल यू स्टडी लास्ट ENT क्लास देखा होगा, राइट? देर इज वन सिंगल वर्ड, राइट? देर इज वन सिंगल वर्ड कैन चेंज a whole scenario of the disease, right? CSOM के complication है, for example, एक वर्ड पूरा आंसर चेंज कर देता है, right? Actually that is the catch point you need to catch in the questions, right? So उसको उसी तरह पढ़ो. Do not take tension, right? Keep it. I know that there will be tension, lots of people will have mood swings now. Be positive, be positive and study as much as you can. है ना? क्या होगा पेपर में, कैसे होगा, वो NB पे छोड़ दो या ऊपर वाले पे छोड़ दो. तुम्हारा काम है मेहनत करना. डू हार्ड वर्क, दैट्स इट. ठीक है, बस इतना ही कहना चाहूंगा. देयर आर सो मेनी मोटिवेटर्स ऑलरेडी, नो नीड टू मोटिवेट यू मोर. ओके, लेट्स स्टार्ट द क्लास. राइट, व्हाट इज द आंसर फॉर दिस क्वेश्चन? Bitemporal hemianopia. What we are asking? We are asking actually about optic tract, right? Optic tract. Now we will draw a diagram and you will also draw the diagram. Okay, reason being, एक बार draw कर लो, इसे समझ लो. Easy है. These questions are very easy to crack, right? One eye and there is other eye, right? Suppose this is our right eye and this is our left eye, right? Optic tract में कितने पार्ट fibers होते हैं? How many fibers do we have? We have two fibers, right? We have two fibers, correct? हाँ, कौन से? Which fibers are there? Nasal fiber and temporal fiber, right? Correct. Nasal fiber किस साइड से आएंगे and temporal fiber किस साइड से आएंगे? Nose कहाँ है? It is in between, right? We have nose. So of course, nasal fiber will be nearer to nose, right? And temporal fiber will be nearer to our temporal bone. So, 'the fiber which come straight is called as temporal fiber. Okay, temporal fiber. But visual fibers will change their directions. Where they change their direction? In optic chiasma, right? Nasal fiber, right nasal fiber. What I'm saying, right nasal fiber will change his direction and will go to left eye. Okay, left eye. So does left nasal fiber will change his direction in optic chiasma and will go to right eye. Okay, ये कौन सा है? Nasal fiber. This is our nasal fiber, right? But remember, temporal fiber, what I am saying, temporal fiber will give vision. Which vision? That is called as nasal field. हमें कैसे समझना है? What do you think? जो नाक के तरफ हमें दिख रहा है, that is because of temporal fibers, not because of the nasal fibers, right? And the nasal fiber will give us temporal vision. यहाँ पे उल्टा है, याद रखना ये चीज. रीजन बीइंग दे कैन आस्क व्हिच fiber is damaged and which visual field will go. That is different, right? That is different. So vision कौन सा जाएगा? Temporal field vision, right? In short हमें क्या समझना है? The nasal fiber will give us temporal vision, right? Temporal fiber will give us this nose side vision. ठीक है? So both can be asked which fiber is damaged, okay, and which vision is gone. It is opposite. याद क्या रखना है? नेजल फाइबर गया है तो टेम्पोरल विजन जाएगा, टेम्पोरल फाइबर गया है तो नेजल विजन जाएगा. बस इतना याद रख लो. क्रॉस सेक्शन याद नहीं रहे तो भी चलेगा. ओके, जस्ट रिमेंबर दिस. सी, टिल द ऑप्टिक chiasma, टिल द ऑप्टिक chiasma, दिस फाइबर्स, इसको हम क्या बोलेंगे? दिस फाइबर्स आर कॉल्ड एज ऑप्टिक नर्व. क्या बोलेंगे हमसे? ऑप्टिक नर्व. एज सुन एज ऑप्टिक chiasma के नीचे इज कॉल्ड एज ऑप्टिक ट्रैक्ट. कहा जाता है? इट गोज इन विजुअल कॉर्टेक्स, ऑफ कोर्स वही से हमें दिखेगा. करेक्ट. चलो, नाउ you will tell, I will write down. First, understand the basic. What is the meaning of anopia? What is the meaning of anopia? Anyone? What is the meaning of anopia? Anopia means whole eye vision is gone. Okay, क्या बोलेंगे हमसे? Full vision. The temporal field and nasal field will be gone. उसको बोलते हैं anopia. Then comes hemi. Hemi का मतलब होता है half, right? So hemi anopia, उसका मतलब क्या है? The half vision of the eye is gone is called as hemianopia. इतना समझ आ गया, right? हाँ, either nasal vision will go or temporal vision. half मतलब आधा विजन जाना चाहिए, इतना समझ लो यहाँ पर. ठीक है, ये दोनों समझ आ गया. then we will go for the lesions which we see. Suppose there is optic nerve damage of right side. ऑप्टिक नर्व डैमेज ऑफ राइट साइड, यहाँ पे डैमेज हुआ है. So now tell me what will happen with right eye. टेम्पोरल फाइबर भी गया, नेजल फाइबर भी गया. सो वी आर गोइंग टू लूज होल आई. इसका पूरा विजन चला गया. सो व्हाट इज गोइंग टू हैपन ओवर हियर? एनोपिया, राइट? एनोपिया ऑफ राइट आई. दोनों फाइबर गए. सो व्हाट विल हैपन? एनोपिया. इन शॉर्ट, राइट आई ब्लाइंडनेस कब मिलेंगी हमें? व्हेन देयर इज अ ऑप्टिक नर्व डैमेज. ओके, इतना समझ आ गया? नाउ वी विल कम फॉर ऑप्टिक ट्रैक डैमेज. Now tell me what is going to happen with right eye, and tell me what is going to happen with left eye. Which fiber of right eye is gone? It is temporal fiber. ये वाला गया, right? But which vision is gone? The vision is gone. कौन सा? Fiber तो ये गया. But if you remember, which vision will go? Nasal side, right? The vision which is going to go is nasal side. So how we will draw? यहाँ पर नाक होता है, right? So nasal vision is gone. Okay, right? Nasal vision is gone. ऐसे लिखा जाता है. Now tell me what will happen with the left eye? Which fiber is gone? Nasal fiber is gone, right? But which vision is gone? That is temporal vision. So how we will draw? Right? इसी को हम क्या बोलते हैं? होमोनाइमस हेमी एनोपिया. दोनों सेम दिख रहे, राइट? होमो होमो का मतलब क्या होता है? सेम जेंडर, सेम ओवर हेयर. सेम दिख रहे हैं ना दोनों आए. सो दिस इज कॉल्ड एज होमोनाइमस. हेमी मतलब हाफ, राइट? एनोपिया कब मिलेगा? व्हेन देयर इज अ डैमेज ऑफ ऑप्टिक ट्रैक्ट. व्हेन देयर इज अ डैमेज ऑफ ऑप्टिक ट्रैक्ट. नाउ सपोज some tumor, okay, some tumor or optic chiasma is compressed. What we are talking? We are talking about this place. It is compressed. Optic tract is compressed. Now what will happen with right eye? And what will happen with left eye? Which fiber of right eye is gone? Of course, the both nasal fibers are going to go, right? Right eye के तरफ जो जा रहा है, this fiber is going to be compressed. Left eye के तरफ जो जा रहा है, this fiber is going to compress. So which vision is going? That is temporal vision of both the side, right? So how we will draw the diagram? बीच में नाक आता है. The temporal vision is gone. और इसी को बोलते हैं temporal vision of the both side, right? By temporal hemianopia. Hemi का मतलब half, right? And this is called as bitemporal hemianopia. समझ आ गया? This is very easy. Just make sure that you will draw diagram one time. So what is the answer over here? Bitemporal hemianopia is due to what? It is due to compression on optic chiasma, and it is seen due to pituitary adenoma. Okay, optic chiasma के पास pituitary gland होती है, so most of the time this is going to be the option in your exam. आ गए समझ में? This is the basic ones. Okay, this is the basic one. ठीक है? Now tell me, take a look over here again. This is the diagram which you see everywhere. जो हमने ड्रॉ की वही है, राइट? यही है ना? Now comes about visual cortex. Visual cortex, right? What we were seeing? We were seeing homonymous hemianopia. In what? In optic tract. Now, suppose there is a damage of right visual cortex. Okay, there is damage of right visual cortex. So what will happen? Visual cortex का याद रखना सेम है ऑप्टिक ट्रैक के जैसा, but there is little bit of adding in it. Homonymous hemianopia with macular sparing, and this is your recent question. This is your recent question. Same optic tract के तरह ही होगा, सब वही है ना. देखो, right side the visual cortex गया, that means what is going to happen? Same what has happened when we have damaged the optic tract. बस उसमें क्या हो रहा है? मैकुलर स्पेयरिंग का मतलब क्या होता है? In hemianopia, what is happening? The half of eye is going, right? Macula is spared. It will look like this. Central vision will not go. That is called as macular sparing. Okay. सेम है होमोनाइमस हेमियानोपिया. जस्ट क्या होगा विजुअल कॉर्टेक्स के अंदर? सेंट्रल विजन विल नॉट गो. दैट्स इट. That's it. This was your recent question. Those who are not able to understand, remember this. Better way, draw it one time. You will be able to remember this. Okay, it is no rocket science, just a normal anatomical question, and it comes every time in the paper. Okay, this is the examiner's favorite question. This can be asked in your paper one as well. Superior rectus muscle. What is going to be caused? Adduction and elevation. The answer is A. There is no mnemonic for this. The most important table in view of anatomy and ophthalmology as well. Okay, anatomy and ophthalmology as well. So इसको तो करना ही पड़ेगा. At least try to remember first ones. Okay, first ones. This is your recent question. Yoke muscle. Yoke muscle पेयर कौन सा होगा? They have asked this one. Yoke muscle का मतलब क्या है? The similar action. Okay, if I want to move my eye down, there will be two muscles which are acting in the same direction. Okay, acting in a same direction. First, I will give you hint. मुझे पता है वो टेबल याद होगा नहीं होगा किसी को नहीं पता. I will give you the hint. At least remember this. Okay. The muscle which contains O, the muscle which contains O, that is oblique, will go with rectus. Will go with rectus, right? The muscle which contains superior S will go with inferior, right? The muscle which contains M will go with L. In short, what I am saying, suppose superior oblique will go with inferior rectus. राइट साइड का सुपेरियर ऑब्लिक मसल गया है, ओके, राइट साइड का सुपेरियर ऑब्लिक गया है, तो लेफ्ट साइड का कौन सा मसल जो सेम एक्शन कर रहा हूँ? inferior rectus. inferior rectus. राइट आई का मिडल रेक्टस इज वर्किंग, द लेफ्ट आई का लैटरल रेक्टस विल हेल्प. ठीक है, ऑफ कोर्स राइट विल गो विथ लेफ्ट, ये तो पता ही है सबको. ओके, देख लो अब कैसे होता है. सुपेरियर ऑब्लिक ऑफ राइट आई will cause depression. Superior oblique of right eye will cause depression. Inferior rectus of left eye will cause depression. Okay, yoke muscle बोलते हैं इसे, similar action muscles. So what is the answer over by looking at the hint? और ये पेपर में काम आता है. It looks difficult. Practice one time, forget it. पढ़ना जरूरी नहीं है हर चीज, पेपर में भी आ चुका है 2-3 बार. What I said, right will go with left, right? M will go with L, right? O will go with R. Superior will go with inferior. Just look at the option. Right will go with left. Right लिखा हुआ है, right? So this is not the answer, right? Try to tell. Superior will go with O, will go with R. O. So that is not the answer. R will go with what? O. So this is not the answer. M will go with L, right? मिडल वाले की बात कर रहे हैं हम. So answer is B. Easy हो गया. This is the way to trick these questions and crack this question as well. ये कर लो एक बार. This is very easy. Please एक बार बस पढ़ना है. Look at the image and try to tell the answer. Pulses. On moving both the eyes in all the 4 direction of the eye, ऊपर लेके जा रहे हैं, बीच में नीचे, ऊपर बीच में नीचे, नोज की तरफ ऊपर, नोज की तरफ बीच में, उसके बाद नीचे, राइट? बट इफ यू कैन टेक लुक ओवर हियर, this eye is staying in the same position. This eye is staying in the same position. Down and out. That is called as down and out position. Seen in which palsy? One liner सबको याद है, इमेज नहीं देखी. Down and out eye is seen in third nerve palsy. third nerve palsy, right? On moving eyes in lateral direction, on moving eye on lateral direction, on adduction, there is a fixed eye. Okay, there is fixed eye. There is fixed eye. This is not, the problem is not in the right eye. There is problem in the left eye. Is called as sixth nerve palsy. Lateral rectus is damaged. Okay, lateral rectus is damaged. So वो क्या लिखेंगे पेपर में? On abduction. On abduction. एबडक्शन का मतलब ही होता है, इफ यू आर स्टडी एनएट, एबडक्शन का मतलब होता है बाहर जाना. ओके, गोइंग आउटसाइड, राइट, आउट, यस. एबडक्शन, ये एबडक्शन है. ओके, सो ऑन एबडक्शन देयर इज नो मूवमेंट ऑफ आई. एक्चुअली उसको बोलते हैं आई विल हैव एडक्शन, अंदर ही रहेगा. ओके, एडक्शन, एंड दिस इज सिक्स्थ nerve palsy. Sixth nerve palsy. Patient presented to you, okay, and patient is having, while reading, or going downstairs, patient is having a diplopia. Patient is having diplopia. Okay, on depression of eye, patient eye is elevated. Patient's eye is elevated. पूरे hints दे दिए. This is your recent question. क्या है इसका आंसर? Yes. Superior oblique muscle is gone. Movement कौन सा गया? Depression. What is happening over here? There is elevation. अब मुझे बताओ, ऐसा ऊपर देख के चलोगे आंखों से तो नीचे दिखेगा कुछ? ऐसा लगेगा ना अंधेरा सा आ रहा है और डबल विजन दिख रहा होगा. टेक जस्ट इमेजिन, ऊपर देखो और तुम्हारे हाथ की तरफ देखो. हाउ यू आर सीइंग? योर हैंड बिकम्स टू. योर हैंड बिकम्स टू, राइट? दैट इज कॉल्ड एज टू विजन. ऊपर देख के फील करना कि हाथ हाथ कितने दिख रहे हैं. दैट इज कॉल्ड एज डिप्लोपिया. क्लासिकल क्वेश्चन है. while reading or going downstairs, patient is having what? Diplopia. कब मिलता है? It is seen in fourth nerve palsy, right? Fourth nerve palsy. Easy था. Okay, these are the some fixed question which is going to be asked. Now we come to the most important disease, है ना? इस पे 2-2 3-3 घंटे के लेक्चर्स होते हैं. The name is glaucoma. I am not going to teach you glaucoma. I am going to make you understand the glaucoma. What is the classical triad of a glaucoma? क्या क्या होना चाहिए in a glaucoma to be called as glaucoma? Yes, and triad है तो तीन आप होंगे. Remember this. Glaucoma का मतलब है increase in intraocular pressure. Okay, due to this increase in intraocular pressure, there will be decrease in visual field. that is called as visual field damage, and third one is optic nerve damage. Okay, this is the classical triad of glaucoma. ये याद रखना, it is going to come again and again, right? Glaucoma is classified by the classification name है इसका एंडरसन क्लासिफिकेशन. ओके, जिमी एंडरसन ने नहीं दिया है. ओके, द नेम इज एंडरसन क्लासिफिकेशन. ठीक है, एंडरसन क्लासिफिकेशन, करेक्ट. नाउ ग्लाउकोमा क्यों होता है? इंक्रीजिंग इंट्राऑप्टिकल ऑप्टिक प्रेशर. रीजन बीइंग whatever कंटेंट और जो सप्लाई आ रहा है, इट इज कमिंग फ्रॉम द सिलियरी बॉडी. इसमें आता है पानी, gives the nutrition and goes out of trabecular meshwork, right? Trabecular meshworks, right? So what is happening over here? Either there will be damage of the drainage system, पानी बाहर निकलने का सिस्टम ही खराब हो गया, और there is blockage of drainage system by some defect in anatomy. एक क्या प्रॉब्लम है? मशीन खराब है पानी फेंकने वाली, या फिर कहीं पर कुछ अटका है, ब्लॉक हो गया कहीं पे रास्ता. So there will be two reasons for increase in intraocular pressure, right? Trabecular meshwork is a main network. ठीक है, क्या बोला था मैंने? What I said, जो पानी आंख में आ रहा है, it is not going because there is defect in trabecular meshwork, right? उसी को हम बोलते हैं ओपन एंगल, बड़ा सा एंगल. Now, if there is defect in trabecular meshwork, machine खराब है, so what will happen? The water will stay inside, बाहर निकल नहीं पाएंगी, मेन मशीन खराब हो गई. So what is going to happen? There will be fluid accumulation. Okay, that's why this angle will increase. That's why this angle will increase, बढ़ता जाएगा. So that is called as open angle glaucoma. एंगल बड़ा हो रहा है, ओपन हो रहा है एंगल. सो ये कॉल्ड दिस, क्या बोलेंगे हम? ओपन एंगल ग्लाउकोमा, राइट? ओपन एंगल ग्लाउकोमा. समझ आ गया एंगल क्यों बड़ा हो रहा है उसमें? नाउ मशीन इज गुड, machine is properly functioning, but there is blockage. Suppose यहाँ पे गैप था, there was a gap. What has happened? Due to suppose लेंस बहुत बड़ी है, lens size is increased. Take a look over here, the gap is very narrow, right? पानी तो अंदर आ रहा है लेकिन बाहर नहीं जा पा रहा है. रीजन, this path is blocked. So from here the water is not able to go out. मशीन पंप काम कर रहा है अपना पानी फेंकने का, बट पानी पहुंचे मशीन तक तब ना, राइट? एंगल कितना था? ओपन एंगल. Now what has happened over here? The angle is decreased. इसी को हम बोलेंगे एंगल क्लोजर ग्लाउकोमा. बात समझ आ गई? ट्रीटमेंट भी वैसी ही होंगी. ट्रीटमेंट विल बी अकॉर्डिंग टू द सिचुएशन. That was basic. Now you try to answer. 75-year-old patient with deterioration of vision. क्या वो व्हाट हैज हैपेंड ओवर है? डिटोरेशन ऑफ विजन, उसका मतलब क्या है? विजुअल फील्ड गॉन, राइट? ऑन एग्जामिनेशन प्यूपिलरी रिफ्लेक्स ऑब्जर्व्ड इज स्लगिश, उसका मतलब क्या हुआ? प्यूपिलरी रिफ्लेक्स कहाँ से आता है? बिकॉज ऑफ ऑप्टिक नर्व. सो व्हाट हैज हैपेंड ओवर हियर? ऑप्टिक नर्व gone, but intraocular pressure is normal. So IOP क्या है यहाँ पे? Normal, right? This is called as normal tension glaucoma. क्या बोलेंगे हम इसे? Yes, reason normal tension glaucoma. Now open angle glaucoma. Okay, क्या हो रहा है इसके अंदर? What is happening? The machine is not working, right? So what will happen? Increase in intraocular pressure. Reason? पानी बाहर जा ही नहीं रहा. So there will be increase in water over here. Ultimately क्या होगा? प्रेशर बढ़ेगा ना यहाँ पे, right? Pressure will be increased. That is called as intraocular pressure increase. Okay. Over here, after some time, okay, after some time, पहले intraocular pressure increase होगा. After some time, visual field will be gone. So does optic nerve damage will happen slowly, slowly. Now comes angle closure glaucoma. Angle closure glaucoma. Angle closure glaucoma, whenever you are going to get a question, याद रखना इसी को बोलते हैं ग्लाउकोमा अटैक. ओके, ग्लाउकोमा अटैक. द फीचर्स विल बी अक्यूट. स्लोली स्लोली ग्लाउकोमा नहीं बढ़ेगा. दिस विल बी एक्यूट, है ना? एमआई का पेशेंट कैसे आता है हॉस्पिटल में? सेम एंगल क्लोजर ग्लाउकोमा पेशेंट विल कम. सो व्हाट इज गोइंग टू हैपन ओवर हियर? Intraocular pressure will be increased. Up, if you have appreciated, visual field optic nerve slowly damage होते open angle में. What I said, angle closure patient will present with what? Acute system symptoms. So visual field will be normal. So does optic nerve will be. ठीक है, everything will be normal. What is going to increase? Only intraocular pressure is going to increase. ठीक है, समझ आ गया? This is the difference between normal tension glaucoma, open angle glaucoma and angle closure glaucoma. इतना याद रखो, you will be able to diagnose any case regarding glaucoma. ये लिखेंगे one way or other way, they are going to write down this triad only. उसी लिए पूछा था कि क्लासिकल ट्रायड किसको पता है, समझे? लाइनर्स भी करने साइड बाय साइड, राइट? frequent changes in presbyopic glass is a feature of what? Open angle glaucoma, right? Frequent changes of distant visions or myopic spectacle is a feature of what? Frequent का नाम लगा हुआ है, याद रखना है, frequent लिखा हुआ. It is seen in cataract. It is seen in cataract. Frequent changes of glasses in young is a feature of what? Frequently change करते हो तुम? No. 2 साल 3 साल बाद करते हैं ना मायोपिक में चेंज, अगर चेंज होना भी हो तो। फ्रीक्वेंट चेंज ऑफ ग्लासेस इन यंग इज अ फ्यूचर ऑफ, इट इज केराटोकोनस, राइट, केराटोकोनस। विजुअल फील्ड डिफेक्ट होता है, विजुअल फील्ड डिफेक्ट होता है, राइट। हाउ इज गोइंग टू हैपन? आइसोट्रोप कॉन्ट्रैक्शन, आइसोट्रोप कॉन्ट्रैक्शन का मतलब क्या है? सपोज आई वॉज एबल टू सी दिस मच ऑफ विजन, मुझे पूरा विजन दिख रहा था मेरे आंखों में। व्हाट इज गोइंग टू हैपन? आफ्टर सम टाइम आई विल बी नॉट एबल टू सी पेरीफेरी फ्रॉम द ऑल द साइड, विजन की साइज विल डिक्रीज। ओके, मेरा जो गोल दिख रहा है मुझे वो नहीं दिखेगा, वो साइज में छोटा हो जाएगा। ओके, blurring of blind spot. Okay, if you close one eye and if you move your finger from one side to other side by looking straight, there will be some point over there. I won't be able to see my hand. That is called as blind spot. So what is going to happen in second stage? That blind spot will go out of visual field. यहाँ पे मेरा जो ब्लाइंड स्पॉट है वो विजुअल फील्ड से निकल गया। Okay, that is called as barring of blind spot. Paracentral scotoma. After some time, what will happen? There will be scotomas. कहाँ पर? सेंट्रल के अंदर। दिस इज कॉल्ड एज पैरासेंट्रल स्कोटोमा। ठीक है, दिस पैरासेंट्रल स्कोटोमा विल गेट अटैच्ड। ओके, दिस पैरासेंट्रल स्कोटोमा विल गेट अटैच, पहले थोड़े से अटैच होंगे एंड इट विल लुक हाफ, हाफ का भी हाफ। ओके, 1/4 ऑफ रिंग विल बी फॉर्म, ऐसे याद रखो। आफ्टर सम टाइम द हाफ रिंग विल बी फॉर्म, इज कॉल्ड एज आर्कुएट। आर्कुएट का मतलब होता है तीर, राइट, बाण जो जिसे मारते हैं हम, राइट, धनुष। और यू कैन कॉल दिस हाफ मून शेप्ड, मतलब ही वही है, हाफ मून शेप। ठीक है, दैट इज कॉल्ड एज आर्कुएट स्कोटोमा। हाफ रिंग फॉर्म होंगी, हाफ मून विल बी फॉर्म्ड। नाउ देयर विल बी टू हाफ मून, दैट इज कॉल्ड एज डबल आर्कुएट। राइट, डबल आर्कुएट। टेक अ लुक ओवर हियर, दिस विल बी कॉल्ड एज, इमेज आ सकती है ऐसे भी, right, paracentral scotomas, right. This paracentral will scotoma will get attached, they will first form sedal or sickle shaped scotoma. This scotoma will get converted into arcuate scotoma, half moon shape, right. After some time there will be double arcuate, double arcuate. This is the steps of visual field defect, right, visual field defect। ये क्या है ऊपर वाला? ऐसी भी इमेज आ सकती है। This blackish is our bearing of blind spot, barring of blind spot. Over here, this is blind spot. Now tell me what is this? Right, 1/4 of ring. Right, 1/4 of ring. So this is our sedal or sickle shaped scotoma. ठीक है, सीडल और सिकल शेप स्कोटोमा। ठीक है, आगे समझ में? सिकल नहीं है, हाँ ये सिकल, राइट, करेक्ट। इसी को मैं ऐसे दे दूंगा थोड़ा करके, तो यहां तक दे दिया तो दिस विल बिकम आर्कुएट स्कोटम. ठीक है, समझ लो, थोड़ा सा है, एक बार ड्रॉ कर लेना, समझ में आ जाएगा. निमोनिक इज आई सी BP should be remembered. Okay, this is the sequence of visual field defect seen in glaucoma. What is the answer for this? 60-year-old woman with below visual defect has been diagnosed on primary open angle glaucoma. Which part of visual field defect will be most resistant or progressive visual field loss? Yes, it is arcuate. Blind spot क्या फॉर्म हुआ है? The half moon shape, right? Half moon shape, that is arcuate scotoma. But अब ये वन लाइनर पूछा है, इतना बड़ा क्वेश्चन देखिए. The answer over here is temporal peripheral vision is the most resistance. Okay, वन लाइनर पूछा है, लेकिन पूछने का तरीका is little bit different. Glaucoma flecken is a feature of acute angle closure glaucoma. चलो, answer is marked. So now tell me, what will be the other predisposing factors of angle closure glaucoma? Small cornea है, या छोटा anterior chamber है, या फिर axial length is small. किसमें होता है angle closure glaucoma? Question will start with this. Women's, right? Yes, hypermetropes. Age will be around 40 to 50. That is called as fourth decade. Right? Female with glaucoma features, answer most of the time which is going to stay is angle closure glaucoma. What is the answer over here? A 68-year-old female, severe pain in her right, pain नहीं है, eye, right pain क्या होता है, right? Eye, blurring of vision, nausea and vomiting. Nausea and vomiting है, blurring of vision है. So increase क्या हुआ? BP is increase. So because of increase in BP, there is increase in intraocular pressure as well. Right? टाइम नहीं लगना चाहिए. ब्लरिंग ऑफ विजन, वॉमिटिंग दिया है, उसका मतलब भी होता है इंक्रीज इन बीपी. बिकॉज ऑफ दैट देयर इज इंक्रीज इन इंट्राओकुलर प्रेशर. क्या है? अक्यूट है, अक्यूट. ना आप पूछोगे सर ये नीचे लिखा हुआ क्या है? दिस इज कॉल्ड वेस्टेज ऑफ टाइम, और दिस इज कॉल्ड एज मसाला. पेपर में डिस्ट्रैक्ट करने के लिए कुछ भी लिख के दे सकते हैं, सो दैट यू कैन थिंक दैट इट इज अ इन्फेक्टिव क्वेश्चन. इन्फेक्टिव एटियोलॉजी है, सीन इन द वार्ड है, राइट? उसका मतलब क्या है? दिस इज एक्यूट प्रेजेंटेशन, अभी अभी हुआ है. ब्लरिंग ऑफ विजन हो रहा है, नाउजिया हो रही है, वॉमिटिंग हो रही है, बीपी इंक्रीज हुआ, इंट्राओकुलर प्रेशर इंक्रीज हुआ, And acute features, as I said, angle closure glaucoma will present as glaucoma attack. So answer over here was, इसी को हम बोलते हैं ग्लाउकोमा अटैक. ओके. सीवीए होता है कार्डियोवैस्कुलर एक्सीडेंट और स्ट्रोक, राइट. बीपी इंक्रीज होता है. वी सेंड पेशेंट फॉर ऑफ्थेल्मोलॉजिकल ओपिनियन एज वेल. रीजन, रूल आउट करना है. ओके. यस. It is not to increase BP, actually it is to check your presence of mind. We are doctors, right? We have to diagnose the patients in emergency as soon as possible. So we need a presence of mind. पेशेंट तो 10 सिम्टम लेके आता है, हमें कैश करना है और डायग्नोस लगाना है किसको है क्या, है ना. पेशेंट कम विद शॉर्टनेस ऑफ ब्रेथ, राइट, राइट. एंड पेशेंट विल कंप्लेन ऑफ नी पेन एज वेल. अब नी पेन तो उसको बहुत दिनों से होंगे. नाउ यू हैव टू डिफरेंशिएट शॉर्टनेस ऑफ ब्रेथ, राइट. उसकी रीजंस क्या है. दैट इज हाउ वी वर्क. वैसे क्वेश्चन पेपर में आते हैं. व्हाट इज दिस इमेज. okay, this image has been asked. Remember, whenever you are getting a question, whenever you are getting a question and you are not seeing a round shaped pupil, a round shaped pupil, गोल होता है ब्लैक होल हमारा. over here it is not round, right. It is not round. This is called as Sainike formation. Take a look over here. This is called as Sainike formation, right. And if we'll put a torch, if we will put a torch on our eye, it will give a sign. ऐसे लगेगा ग्रहण है, eclipse. This is called as eclipse sign. क्या बोलेंगे हम इसे. eclipse sign बोला जाता है इसे. ठीक है. If you put a torch, there will be only one dot in normal eye. But now take a look over here. Eclipse sign. Okay. This is seen in again angle closure glaucoma. Now tell me, what is the definitive management of angle closure glaucoma? Problem. First slide when we were discussing pathology. The problem was the water flow is not able to reach. The water flow from here was not able to reach the trabecular meshwork, right. So what we'll do, we will cut this muscle so the water flow can reach directly in the machine, and this is called as peripheral iridotomy. क्या बोलेंगे हम इसे. peripheral iridotomy, and that is the treatment of choice. Okay, that was the one question. Other question is, what is the first line management. What is the first line management. Take a look over here. Blurring of vision, that means increase in intraocular pressure. Intraocular pressure is going to increase because of what. There is increase in intracranial pressure. There is increase in intracranial pressure. Stroke के patient में भी ये होता है. So what do we need to give to patient to decrease the intracranial pressure, so the pressure in the eye will decrease? That is mannitol, right. Mannitol देते हैं stroke के patient में. Same we have to do it over here as well. So what will be the management? First line will be mannitol. Give the mannitol, decrease the intracranial pressure, so patient will have decrease in intraocular pressure. Yes. To break the attack, what we are going to give? We are going to give pilocarpine. इसी को हम बोलते हैं drug of choice, but treatment of choice is going to stay पानी को मशीन तक पहुंचाना. How? By cutting the muscle. That is called as peripheral iridotomy. And as soon as if you जब हो गया ये peripheral iridotomy is done, if you look at the eye, there will be one hole, and this is how the eye is going to look. क्या हुआ यहाँ पे? कट किया है मसल को, that's why there will be hole. ठीक है, ये है आइरिडोटॉमी वाली आई. Understood? This is how it's going to look. You know the mnemonic about congenital glaucoma, but even examiner also knows the mnemonic. All except पूछा गया. Don't run on the question. It is blepharospasm or ophthalmus. Mnemonic is, you know the mnemonic, BPL. But as I said, even examiner knows this mnemonic. It is blepharospasm or ophthalmus. Ophthalmus is not seen in congenital glaucoma. Blepharospasm is seen in congenital glaucoma. Now tell me how the eye will look. Eye will look blue, right? Which stria are present on congenital glaucoma eye? कंजेनाइटल का नाम ही है बच्चों में देखना. टेक अ लुक ओवर हियर. There are horizontal stria. There are horizontal stria. This is called as, कौन सा ये? Horizontal है ना? इसी को हम बोलते हैं हैप्स. H goes with H. Okay. Vox stria is vertical. Vertical ऐसे होंगे. Vox stria. V goes with V. Okay. ठीक है. Recent question. Yes. बीटा ब्लॉकर का साइड इफेक्ट है, right? What is going to happen over here? Bronchospasm, right? So beta blocker are contraindicated in asthma, right? Beta blocker are contraindicated in asthma. पढ़ा है ना? Timolol are beta blockers. Which other agent we use for treating glaucoma? Anyone? Prost सुना है? Prost, latanoprost. Latanoprost are which drugs? These are prostaglandin analogs, right? और कौन सा होता है? एसेटाजोलामाइड, करेक्ट. एसेटाजोलामाइड कहाँ पर, कौन सा क्लास का ड्रग है? दिस इज कार्बोनिक एनहाइड्रेज इनिबिटर, राइट? इनिबिटर, yes. This is the table. Okay, either read from the pharma if you have done it. At least remember this drug. Reason being, this has been asked again and again. Beta blockers किन patient में नहीं देंगे? It is contraindicated in heart patient as well for treatment of glaucoma. Okay, ग्लाउकोमा के ट्रीटमेंट में बीटा ब्लॉकर यूज नहीं करेंगे इफ पेशेंट इज वेल नोन केस ऑफ हार्ट डिसीजेस. ठीक है. लॉल प्रोस्ट गोज विथ पी, पी गोज विथ पी, प्रोस्ट. ठीक है. अल्फा एड्रेनर्जिक क्लोनिडिन सुना है ना, राइट. कोलिनर्जिक एजेंट कौन सा है? पाइलोकार्पिन. वी हैव यूज्ड दिस टू ब्रेक द अटैक एंगल क्लोजर ग्लाउकोमा में, राइट. थोड़ा सा पढ़ लो इसको. little bit latest for you. What is machine खराब है, right? Machine खराब होती है, we will put another artificial machine, right? We will put another artificial machine. ट्राइबेकुलर मेशवर्क खराब होता है ओपन एंगल में, राइट. मशीन गई, we will put other artificial machine and the name of this machine is शैतान. That is called as Satans, right? Satan सुना है, उसी को बोलते हैं शैतान इन हिंदी. और also called as Ahmadi wall. We will put another machine like this. Okay, ओपन एंगल ग्लाउकोमा के अंदर. Patching of normal eye is done in which disease? Anyone? It is done in amblyopia. इसी को हम क्या बोलते हैं? ऑक्लूजन थेरेपी. ऑक्लूजन थेरेपी बोलते हैं इसको, राइट. Patient presented with proptosis and swelling on the eyelid is called as orbital cellulitis. ऑर्बिटल सेलुलाइटिस. क्या क्या बोला मैंने अभी? प्रोप्टोसिस प्लस स्वेलिंग ऑफ आईलिड, राइट. आईलिड. रीजन क्या होता है इसका? मोस्ट कॉमन कॉज, द मोस्ट कॉमन कॉज इज इन्फेक्शन इन द नोज, दैट इज कॉल्ड एज साइनोसाइटिस. साइनोसाइटिस तुमने पढ़ा होगा इन ईएनटी. नाउ टेल मी मोस्ट कॉमन साइनोसाइटिस लीडिंग टू ऑर्बिटल cellulitis. That is ethmoidal sinusitis. Okay, most common cause. And you don't know the answer is always going to stay staph. Okay, staph aureus. What is happened over here? On the leads there is swelling, इसी को बोलते हैं lead edema. A child with swelling on the lead and purulent discharge. Purulent discharge, ये जो दिख रहा है, is called as what? क्या बोलेंगे इसे? ऑफ्थेल्मिया नियोनाटोरम, है ना, आंख आना, राइट. नाउ पेशेंट child is having lead edema plus purulent discharge. on 1 or 2 days. What do you think? What will be the answer? Answer is chemical, right? That's why we don't use gloves for a newborn baby. Okay? नहीं करते. There are chances of infection. Then comes 2 to 4 days and 5 to 13 days. Answer बदलेंगे. Who will tell me 2 to 4 days and 5 to 13 days? ये फिक्स क्वेश्चन होते हैं एग्जाम के. मैं स्क्विंट क्यों नहीं पढ़ा रहा? There is a reason. There are other fixed questions which can give you out of marks. 2 to 4 days, yes, gonorrhea. 5 to 13 days, chlamydia. Okay, chlamydia, right? Yes. What has happened in first time? What do you think? There are hairs on the upper eyelid, but there are no hair or 1-2 hairs. This is called as क्या बोलते हैं इसे? Yes, this is madarosis. Now take a look over here. Normally eyelashes are outside, right? Eyelashes are outside. एक दो hair इधर दिख रहे, which is normally present in our eye. But what has happened over here? This is called as misdirected cilia. Misdirected cilia. क्या बोलते हैं इसे? This is yes, trichiasis. Okay. Eyelid नहीं है inverted. The hairs are not in the normal position, right? If eyelid is inverted, that is called as entropium. Okay. यहाँ पे hairs की बात हो रही है. Normal eyelid, eyelashes, right? But if you can appreciate, there is one extra row. यहाँ पर एक extra row बन रही है. Extra row को क्या कहते हैं हम? Yes, that is dystrichiasis. Okay, dystrichiasis. Do not confuse between misdirected cilia and extra row cilia. Okay, difference is in front of you. यहाँ पे एक्स्ट्रा रो नहीं है, एक ही रो है जो ऊपर जा रही है. Over here there is a clear cut extra row. Okay, now this is called as entropium. Inward movement of eyelid, that is inverted eyelid, इसको बोलते हैं entropium, right? What has happened over here? The eyelid is going out, so outward movement of outward eyelid will be called as what? Ectropion. Ectropion. ठीक है. What is this? First one, take your time and think. There is a connection between tarsal conjunctiva and bulbar conjunctiva. क्या हुआ है? Connection form हुआ है tarsal conjunctiva and bulbar conjunctiva. Is called as what? Should I write down definition or not? Okay, I will write down. Adhesion between tarsal and bulbar conjunctiva is called as what? Yes, symblepharon. Okay, symblepharon, correct. Now there is adhesion between upper eyelid and lower eyelid is called as what? Adhesion between upper eyelid and lower eyelid will be called as what? Yes, ankylobepharon. Okay, ankylobepharon. ठीक है, ankylobepharon. Recent question. Swelling between eye and nose, दोनों के बीच में. Something goes like this and open in the nose, right? क्या होगा यहाँ पे? The infection of nasolacrimal duct is called as what? Dacrocystitis, right? Dacrocystitis, yes. Inflammation of nasolacrimal duct या फिर lacrimal sac भी बोलते हैं इसे, right? What is the treatment? This was your question. Acute dacrocystitis में क्या करेंगे हम? Cystitis infection. So what we will give? We will give antibiotic. Plus क्या देंगे? Hot pack. Plus and minus drainage. But question never comes on this. The question comes on chronic dacrocystitis. और यही पूछा जा चुका है. Chronic dacrocystitis मतलब क्या हुआ? Recurrent nasolacrimal duct infection. Okay, so what will be the treatment in this? Has been asked, and this is your recent question. What do you think? क्या करते हैं chronic में? Dacrocystorhinostomy. ठीक है, रिपेयर ऑफ लैक्रिमल डक्ट, राइट? सर्जरी करेंगे नॉर्मल माइनर, राइट? Normally lacrimal duct opens in which meatus? On nasal wall, inferior. What we will do? We will put a probe which is going to open somewhere else. So dacrocystorhinostomy mein the opening is made at what? Yes, that is middle meatus. Right? And normally nasolacrimal duct open in inferior meatus. सब पूछा जा चुका है. Even they asked, normally lacrimal apparatus or nasolacrimal duct opens in. Okay. Second question, chronic rhinocystostomy is done in, right? Recurrent dacrocystitis, nasolacrimal duct infection. What should be done? The answer is, this is your recent question, asked many times. हिंट भी है, सब कुछ है, इतना तो पेपर में आएगा नहीं. स्टिल ट्राई टू आंसर. इन शॉर्ट, वन लाइनर. इट्स लुक लाइक देयर आर कॉटन वुल्स. सफेद सफेद कलर के वुल है. दिस इज कॉल्ड एज कॉटन वुल अपीयरेंस सीन इन व्हाट. एक क्वेश्चन तो यहाँ से आता है. सच अपीयरेंसेस. घुमा फिरा के यही पूछना है उन्होंने. द आंसर इज diabetic retinopathy. Proliferative diabetic retinopathy. And what is the treatment of this? Treatment will look like this. What is we are going to do over here? क्या कर रहे हैं इसके अंदर? We are going to do a photocoagulation. Yes, this is called as pan-retinal photocoagulation. Right? What we are going to do actually? यहाँ पे photocoagulation करेंगे. So you will see actually this is surgery. Okay, kind of surgery समझ लो. ये होल हमने गिराया है इसके अंदर. Okay, we have done this. Okay, it is not appearance of a normal eye or a diseased eye. We have made this one. Yes, coagulation करके what we are doing? What is increase in diabetes? VEGF increase होता है. Okay, VEGF increase. By doing this, actually we are decreasing VEGF. And also we are decreasing oxygen demand. Okay, one question. Tomato splashed or केचप अपीयरेंस. ऐसा लग रहा है केचप डाला हुआ है या फिर किसी ने टोमेटो फेंक के मारा है. एंड देयर आर डॉट्स ऑफ टोमेटो. है ना. दीवार पे इफ यू विल थ्रो अ टोमेटो ऑन द वॉल इट विल लुक लाइक दिस. राइट. स्प्लैश्ड टोमेटो अपीयरेंस इसी को बोलते हैं. एंड दिस इज योर recent question. CRPO. What are the causes of CRPO? क्वेश्चन बहुत बड़ा था. क्वेश्चन बहुत बड़ा था. But what they have given hint was this one. Causes of CRPO आने चाहिए. ऐसे नहीं होता. Now there is a confusion in people's that cherry red spot is seen only in CRAO. No, it is non-specific. ये दिख रहा है डॉट. This is called as cherry red spot. Okay. Cherry red spot. Whenever you are getting question on cherry red spot, first option will be CRAO written over there. But please look at the question carefully. Question can be from other diseases as well. Okay. पूछा ये जा रहा है. This has been asked. Okay. They're not asking about CRAO. So Tay-Sachs disease, please read from your biochemistry. Okay. Mnemonic चाहिए. Cherry red spot is seen in cherry tree never grows tall. Okay. If you want this, you can use this one. थोड़ा सा बचा है. Try to answer this. We will go fast. बीज होते हैं. We have beans over here, and it look like a flower. That is called as flower vase appearance. Seen in what? Yes, cystoid macular edema. Right? What is this? What do you think? This is called as pachymetry. Why do we use pachymetry? To check thickness of cornea. Why we are going to use? We are going to use for to check thickness of cornea. What is this? This is called as keratometer. K sound similar with curvature. Okay, K sounds similar with curvature, है ना? Similar sound कर रहा है. So that is why we are going to use keratometer. What are this? This is to check what? First, what is this? Applanation. Tonometer. Right? Tonometer. Then there is something called as tonopen. Okay. And classical tonometer. Yes, to check the tone. Classical tonometer, which was prepared, is called as Sizont. Sizont. Shiatz. Sorry. Shiatz tonometer. क्या है? Take a look over here. And take a look over here. There is continuity on this side, है ना? Floor of the orbit is continuous. Over here, टूट गया. Over here, there is a fracture. This is called as, क्या बोलते हैं इसे? Yes, fracture of orbital floor. Right? Blow out fracture इसी को बोलते हैं. Floor fracture हुआ, उसी का नाम है blow out fracture. This is on X-ray. Right? This is on X-ray. And this is on CT scan. Take a look over here. There is continuity. There is continuity. But in this, there is no continuity. Please mute yourself. There is no continuity. This is on CT scan. Recent question. Recent question. What is the difference between first image and second image? Take a look over here. It is round, right? It is round in shape, right? It is round in shape. इसी को बोलते हैं blind spot. Okay, it is blind spot. Over here, what has happened? First is increase in the size, right? Increase in the size of blind spot. समझने के लिए बता रहा हूं. Okay, this is not the way. Increase in the size of blind spot. Now take a look over here. The margin is clear cut. The margin is clear cut over here. समझ में आ रहा है कुछ? Right? No, this is called as blurred margin. This is called as blurred margin. And if you can appreciate the rest of the thing, we can see clearly. Right? Clearly दिख रहा है. Now take a look over here. ये सब तो clear है. This side is also clear. But take a look over here. What has happened? There is a rupture of one vessel. There is rupture of one vessel is called as what? What we will call it? Hemorrhage. Hemorrhage pulling is here. This is the feature of what? Yes, the answer is papillary edema. What has happened? Papillary edema. This is normal image. क्या हुआ था यहाँ पे? Increase in size, right? Size increase हो गई थी. Okay, edema है तो size increase होंगी. These are the features of papillary edema, and this was your question. Okay. Eye spec test is done in which disease? Actually, ये disease आजकल famous चल रही. Yes. Okay. Take a look over here. This is myasthenia gravis patient. Okay. This is myasthenia gravis patient. As soon as we will put a eye spec, take a look over here. Okay. The drooping of eyelid is gone. Okay. It is done in myasthenia gravis. कौन सा टेस्ट है? इन्वेस्टिगेशन का नेम है आइस पैक टेस्ट. ओके, आइस पैक टेस्ट. ट्राई टू रिमेम्बर दिस टेबल. इंपॉर्टेंट है, आना भी चाहिए. ओके, वन लाइनर्स शुड नॉट बी मिस्ड. इफ यू आर मिसिंग एनी रेयर क्वेश्चन और कॉम्प्लिकेटेड डिसीज क्वेश्चन, ओके चलेगा, पर वन लाइनर नहीं छूटना चाहिए, बिकॉज इट इज डूएबल. Okay, I have deliberately left some topic. Reason being, हमें passing marks secure करने हैं. Okay, there is nothing called topper in FMG. Okay, it is pass or fail. Either you will be zero or you will be hero. So मैं passing marks पहले secure करना है, बाकी बाद में. Okay, do at least this much. If you have done this, then go for the rest of the topics. ठीक है, there is reason to leave some topics. पहले ये तो खत्म कर लो यार, ना? With this we will end the session. ठीक है, thank you all. Okay, thank you all. See you soon in the next session.